Welcome to the Creighton University CPHHE Mental Health Podcast. My name is Monica Lewis, and I am a licensed independent mental health practitioner with Lewis Counseling and Visitation Services. And I have two great, wonderful hosts with me. I have Johnny.
Yeah, Johnny No Good, founder of Behind the Stigma, an intergenerational mental wellness peer support group for Black men specifically. We've been running since 2022.
And then I have Peyton.
Yep, my name is Peyton Hogan. I am the owner of Bear Company Counseling. I too am a licensed mental health therapist, and I've been in the game since 2019.
And we are your hosts for this podcast. Welcome, 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 welcome.
Yeah.
Today, our discussion is on trauma. What do we know about trauma and PTSD, post-traumatic stress disorder?
Well, I'm gonna throw out there, PTSD ain't the only traumatic diagnosis that you can have. In fact, there's quite a few. You got acute stress disorder, adjustment disorder, reactive attachment disorder, disinhibited social engagement disorder, and other specified disorders. So there's a plethora of traumatic disorders that when we're looking at trauma in general, but PTSD is the most common. And a stat that we could throw out there also is that 25% of adolescents or children who experience traumatic events in the future have a higher propensity for being diagnosed with post-traumatic stress disorder.
Do you notice that those adolescents also have reactive attachment disorder?
Let's talk about it.
Well, lots of time they are diagnosed with reactive attachment disorders first, right? And then later on end up with that diagnosis of PTSD. They kind of run kind of hand in hand is what I have saw.
Yeah.
Do you agree with that?
I do agree. Real quick though, break down what exactly, I think in layman's terms, so people who might not have a clinical understanding of it can understand what is reactive attachment disorder.
You know what? That's not my expertise. I don't know if I can give a real clear definition. Can you help me out with that, Peyton?
I can a little bit. So reactive attachment disorder is going to come from, or it's not going to come from, but what it is a child who is experiencing some type of abuse or neglect. It is a traumatic disorder that impedes on the child's ability to be able to function in healthy relationships. So they have some type of heightened emotional response when it comes to their situations and surroundings. Excuse me, based on like being in neglect or abuse situations.
And so when we look at that compared to PTSD or putting them side to side, what do we see as the two go hand in hand with each other?
Yeah, so I think like with PTSD, there's a couple of different symptomologies that we want to touch on. One being like, of course, being exposed to a traumatic event, right? Then we also have to look at, are there like intrusive or distressing memories, dreams, flashbacks that are present? Does it disturb or distort my cognition? Is there some type of physical response that I'm experiencing, right? And is this happening over a long period of time?
Right. And so for that child that has gone through reactive attachment disorder, who has experienced those issues, especially if they were in a home where they had been abused or neglected, they might then also be experiencing other symptoms such as the nightmares, such as the flashbacks, such as smells, things that can also trigger them to go into having some other symptoms.
100%. 100%. I do think it's important to touch on though, like when we're talking about trauma doesn't necessarily have to be attached to these diagnoses either, right? When we think about these diagnoses, we think of what I like to call big T trauma, like these huge experiences that like really ingrain themselves into our psyche and into even our physical experience. But there's also what are known as little T traumas, or things that still have an impact on my emotional or mental experience of life. But when we look at it, it's not this major or catastrophic event. It's not a death. It's not an abuse situation. It's not any of that, but it could be as simple as, right, like me and you talking and you tell me you don't want to be my friend anymore.
I don't mean to laugh, but
but it can be traumatic for someone.
right.
That could be traumatic.
It could be traumatic because maybe they, identified you as a person that they wanted to have in their life, and there was something about you that they felt was very special to them. And maybe you reminded them of of a parent that they lost, or a relative, or a brother, or something.
That's heavy.
And so by you taking that, that friendship away from them, it's like losing a part of themselves. It's very traumatic for
That's
them.
heavy. Could you finish your train of thought? Because I didn't mean to laugh at you.
No, you're good. You're
because
good.
it made me think about something.
And then I went into it. I'm sorry, Peyton.
It's all good. It's all good. I think the transition and the flow was good. But what I was getting at is trauma really is anything that has an emotional impact on you. That's it. It's anything that has an emotional impact on you. Anytime that we experience something and it puts our emotions into a elevated or heightened state, it could be considered trauma. Now, does that mean that every trauma we experience is going to have this life-altering impact? No. We might know how to process through some traumatic experiences, small T and big T. But there's also going to be those other ones, small T and big T, that we are not equipped to process through, or we don't know how to process through. And that's where we start to see, right, like these little experiences start to compile and start to develop the symptomology of the known diagnosis that we went through earlier on.
That's heavy. That definitely helped me reanalyze the situation in which there was a young man who was kind of, I wouldn't say under my tutelage. I view him as being one of my equals, but he viewed me as being a mentor. And we kind of had a situation where I told him I didn't want to be a part of something that he was doing. And I could tell that it caused a major rift within the relationship, and he took it pretty hard. And it was almost like me saying that I didn't want to be his friend because I didn't want to be a part of what he had going on. So when you talked about this and you explain it, it helps me reanalyze this from a different perspective, especially if he potentially had which I called it reactive attachment. So just looking at things from different lenses, that's why I think it's important to have these conversations, right? Because not only are we bringing we're getting rid of like stigmas and helping people understand what things aren't. We're giving them verbiage and toolkits to be able to understand what things are. As y'all was going through that, I'm analyzing like, dang, bruh, I ain't never had a successful relationship. You know what I'm saying? We use the words like self-sabotaging and stuff like that. But do I struggle with a reactive attachment disorder because of things that I experienced in my childhood that then don't allow me to function within the fullest capacity in a relationship? So in this conversation, I'm feeling like a student, you know what I'm saying? So I think this is why it's important to sit with licensed therapists and professionals who can help us understand the symptomologies and then understand what these things look like in real life. So thank y'all for being a part of this conversation. I'm sitting over here taking notes.
Yeah, reactive attachment is something different. It really is, because people with reactive attachment disorders, they really do struggle when it comes to relationships, and not not because they're not capable of having good relationships, because they are. I think that there's like some hypersensitivity that is present with reactive attachment. Would you agree, Peyton?
I agree. Yeah, I agree with that. I think it also leads, especially like when we experience traumatic experiences from our primary caregivers, like our parents, or if you were raised by somebody else, like a grandparent, or you were in the foster system, we start to develop these different attachment styles. And I don't know if now is the time to really get into them, but
Go ahead.
Our attachment styles will determine how we respond to traumatic situations. Again, we have to remember that there's a spectrum of trauma, and not every trauma is this big thing. But like a traumatic situation could be me and my partner getting into an argument, right? Because when I was a kid, I remember my parents getting into an argument, and this is not valid, but this is an example. I remember my parents getting into an argument and my dad smacking my mom. And so now for me, I equate argument with physical violence, right? But I might not want to be the perpetrator of physical violence, but it brings a heightened state inside of me. And so now I have this avoidant attachment style where when I have or I sense that things are going to get hostile or chaotic, I just remove myself from the situation and I'll sabotage it. I'll say, this ain't for me. I ain't even about to deal with this. I'm not about to do this. Even though deep down inside, that's not what I really want. But that's how I'm going to manage the situation right now.
Because I don't want it to get to this point.
Boom. But then there's also the opposite end of that, where it's like, if I did witness something like that, now I have
Propensity.
go ahead. Oh, go ahead.
No, I was just finishing. Come on.
Oh, yeah.
No, I'm with you.
Oh, no.
Go ahead.
Okay, yeah. I might have the propensity to do that. You know what I'm saying? And so my attachment style might present itself as unsecure, right? I have an unsecure or insecure attachment style, right? What now, like in this heightened state, I don't want to lose you, and so I'm going to control. I'm going to seek to control you or control this situation. Kind of a side caveat: a lot of people who are abusers, one, I don't condone abusing in relationships, but a lot of people who are abusers, their abuse does not come from a place of wanting to hurt another person, but it comes from a place of wanting to control the dynamic in the scenario, so it does not get out of order because they were raised with so much disorder. Again, this does not abuse abusive behavior, or it doesn't excuse abusive behavior, but rather I think it's good to understand that abusers usually are dealing with some type of fear of returning to traumatic situations that they perpetuate and create their own traumas going forward in their life.
I was just ad-libbing what you paid.
Fact. No, you good.
I was
good.
just ad-libbing.
You good.
We both said propensity together.
There we go. There we go.
Yep.
What is? Oh, go ahead.
I was just saying I was in total agreement with what you said.
Yeah. What is something that either of you have noticed when it comes to, because you work with Black men in the mental wellness space, you're a licensed therapist. What's something that you've noticed when it comes to the individuals that you work with and their capacity to acknowledge the traumas that they've experienced?
I'll let you go first.
Well, something that I've noticed, I think, first of all, I am also an EMDR certified trained therapist, which is eye movement desensitization reprocessing therapist, as well as a CBT trauma therapist. So trauma is one of my specialties. I've noticed a lot when dealing with people with trauma. I think a lot of times when people come in to talk to me, that's not what they lead with. You know, that's just not their first. I hear it as we're talking. They don't lead with it. There is also sometimes when we're talking, when I ask about trauma and they don't disclose it, but I hear it when we're talking. I think it's important as a clinician to allow the patient to get to a place where they're willing to talk about it and not force it. Don't you agree? There has to be a sense of comfortability. Once you're in that place of comfortability, allowing them to gradually get to that point where they're willing to kind of disclose what those traumas are. Even though we know that there's a little T and a big T, I'm speaking right now more of those big T's, more of those life-changing events, more of those moments that make a person sit and question what's next. Where do I go from here? It's those moments and it's those times when I'm with the patient where it is so important to be still and to allow them to really express what it is that they want to express at that moment, and then help them process that out. I like EMDR because even though we talked a little bit last segment about not wanting exposure therapy for some anxiety symptoms or some anxiety disorders, PTSD is one of those moments when we're using EMDR, we're not necessarily exposing them to the trauma physically, but we take them back to that moment. And we have to sit in it. We have to process it out. We have to break it down. We have to look at it in a totally different way than they did before to allow them to heal through it. Very powerful form of treatment. Very powerful form of treatment. It's in those moments, though, Johnny, where I see the most change. because people can find themselves trapped in a traumatic episode, in a traumatic moment that has been going on since childhood.
Yeah.
Wouldn't you agree, Peyton?
Yeah.
And because of that, it's like their life was halted in a way, you know? And what they decided at that moment to do in order to help them get through that traumatic moment, in some cases, not all, but what they have allowed themselves to do to get through that moment has carried on. And now they're at a place when they come to see me, I can't do this anymore. I don't know what's wrong. Help me through it. And when I say they don't lead with it, but I hear it,
That part.
it's that piece of it. I'm at a place, I don't know what to do.
That part. So I think from my experience with working with Black men, our group is intergenerational. So we have members as young as 6 and as old as 86. And there's definitely a different dynamic as far as the openness and the willingness and comfortability with even sharing or talking about certain traumas. And one thing that I've noticed is what you were talking about with the treatment symptom or treatment method that you just mentioned, is that seems to be something that will be very effective for some of our older men who don't have the tools to be able to verbalize what they go through, but you watch them relive it in real time. We had a brother who talked about like something he had going on from his childhood. He was bullied, and literally while recounting the story, you can literally hear him revert back to the inner child of himself, and you can hear the pain of the situation, but he hasn't necessarily really verbalized how much it affected him. So one thing I have noticed is that some of our older brothers, they tend to walk around with this trauma a lot more hidden within them, that you have to have a vigilant ear to even hear that they're expressing trauma. With some of the younger brothers, they're more open to expressing it, but a lot of times their traumas might not necessarily be big T traumas. It might be little T traumas that the next person who's been through something more traumatic might discount the effect of it on them. Where it's like, okay, your parents split up. Well, my parents was never together, you know? So I do think that sometimes that's a dynamic that we see, and we create an environment where we can all feel supported no matter how big or how small our trauma is to us. And I think it's important to understand, right? Like even in the medical field, trauma is a wound.
Yeah.
So you go to the trauma unit, trauma is a wound. So whether it's an emotional wound or it's a physical wound, there is a healing process that have to take place. And so we have to acknowledge that what might be trauma for you
It's not trauma.
is not trauma for me. And what might be trauma for me is not trauma for you. But how can we create an environment where we do feel open enough to express those things and then have the tools to be able to help each other? So that's something that I've noticed, is that some of our older Black men walk around carrying the experiences of things that happened in their childhood, that when they mention it, they revert back to the childhood at the time and the place and space that they were when it happened. And even for me, I still identify with the age that I experienced my greatest trauma. So I had to realize I'm about to be 34. I'm about to be 34 out here. But in my mind, I still struggle with identifying at being 19 because that was the age in which mentally I was stuck in. So especially when the trauma happens. So I think it's important to understand that there are tools and some people are walking around still stuck at the year that their trauma happened to them.
I think something big for a lot of men, especially a lot of Black men, and I like to say or speak from the perspective of a Black man because that's my experience.
Right.
But I think for a lot of us, shame is on both spectrums of talking about our trauma, right? The shame of other people knowing about what I went through, the shame of not being strong enough to not have this thing actually bother me, the shame of what other people will think about. Like shame really is at the core of it. Like when you were expressing like what the older brothers would, struggle with actually processing through, there was a period in time where you couldn't like have any type of like down, like no, we ain't doing that. And so now I feel shame when I feel any of that. Like I'm not strong enough, or I'm weak, I'm this, I'm that. Which there is a small piece of like our resilience that is in that, but it also, right, like too much water will drown you. Too much of that, is drowning you, right? Like if you constantly in this state of survival, like it's not healthy. We talked about that in the anxiety episode.
Right.
You know what I'm saying? And so it's that, but then there's also the shame of like, my problem ain't even that big, and like I'm struggling with this. Like this is trauma for me. You know what I'm saying? I think it is really important for us, not just as men or as Black men, but as everybody, to really start to address the shames that we are holding on to.
Absolutely. Okay.
That's it.
That's it.
I thought you was about to go.
I
there.
know, me too. I was like-
That's it. That's it.
Yeah.
But yeah, you're right. It is important that I think collectively that we all look at that, because some people don't even realize how something affected them. They might think that they have dealt with it. They might think that they've dealt with it and dealing with it, you know, and then when they have something else happen and they respond to it in a way, and people is like, okay, but what's wrong? How come you responded that way? It takes them a minute. It takes them a minute to figure out, oh, well, dang, I don't know. But let's look at that. How come you responded that way instead of this way?
Yeah.
And before you know it, as they reflect back, it's because of the trauma that they've experienced in the past that made them feel that they had to respond that way. That's their way of being guarded. That's what their way of kind of protecting themselves in that moment. You know what I'm saying, Peyton? And so it's something that sometimes people do as a way of trying to reinforce themselves to be okay. And it could be off-putting to someone else, but it's a protective factor for them. You know, you see that a lot within relationships, especially with people who have experienced sexual abuse, men and women. You know, Peyton mentioned earlier about men sometimes feeling uncomfortable, you know, exploring those things in the past because they feel like a sense of guilt themselves. They feel as if they somehow are weaker because something happened to them, when in fact, you're stronger for it because you're still here. In fact, you should actually look at yourself and be proud because you have lived through it.
That part.
And that you are able to move forward and not allow that past to succumb you. And so looking at it from a different lens of us being able to say, this has happened, but this is not who you are.
That part.
You've experienced this, but this experience isn't happening at this moment.
That part.
I believe that's the destination for anybody that has experienced trauma. Like that's where we want to be able to get to. I think it's hard though in some situations, in some scenarios, especially like when we look at, I don't have the exact statistic, but I know it's somewhere around here. When it comes to just like men who experience sexual trauma, they are twice as unlikely to report. So on statistics, it looks like there's more women who experience sexual trauma, but in all actuality, it's really about even
Right.
in the occurrences. So men and women experience sexual traumas almost at the same rate, but women are just more likely to report that. And so when we go back to like that whole piece of feeling shame and guilt around it, like it's hard to go from zero to hero in that story for a lot of men, because
It is.
man, like I was so vulnerable in a state that I got taken advantage of in this way.
Yep.
You know, how can I be the hero of that story? I think. Go ahead.
I'm sorry.
No, go ahead.
And I think it's important for us as not just as professionals, but as peer support people, as mothers, as sisters, as girlfriends, as wives, to be able to allow them to see themselves as who they are at this moment. You know, to go from zero to hero, you never was a zero. You were always who you are. There was a moment where you were not able to defend yourself. You were 5 and the person was 30.
Right.
You know the dynamics between those two people.
Hmm.
You know, 5-year-olds, they think they tough. They got their little muscles,
Hmm.
but they're not able to defend themselves
Mm-hmm.
against somebody who's 15 times bigger than them.
Mm-hmm.
It's just not possible. But in their little minds, they should be.
Mm.
When they're 15 in their mind, they should be.
Right.
When they're 10 in their mind, they should be. And I think it's important for us to be able to say, I hear you.
Mm.
Ooh,
I hear you.
ooh.
Mm.
But in reality, you did the best that you could at that moment.
That part. And I think a lot of that shames come from not knowing how. And it's not like, you know, when we was talking about other mental health illnesses and stuff like that, or things that's afflicting people, is like, when it comes to that specific dynamic, it's not a celebratory thing of how common it is, but it's a very common occurrence. And I think it's about the dynamics of roles and the dynamics of who we feel are victims. And not every young man who has been taken advantage of sexually was taken advantage of by another man.
Nope.
We have women who take advantage of young boys all the time. So I think about me and my friends, and one of my homies was 14. He was talking to a chick that was 26. We're not looking at it that way, but that's sexual violence. That's a predator right there. You are after a young man. I think about people within my family who was taken advantage of and forced to do acts against women. You know, like that's a dynamic in which it's not as reported. And even when I think about historically us as a people, we talk about the sexual violence that happened to women during slavery. We don't talk about the sexual violence that happened to men during slavery. So
Absolutely.
it's something that we have to walk around with. And like you said, there is no feeling like you are the hero in the story in which you felt powerless. And so I think about people like that happened in my family and just different people. It bothers me. I think about even for myself, I was so upset that something happened to somebody close in my family that I didn't know nothing about.
Right.
It make you feel like, dang, how you gonna tell me about such and such late on the bill? You gonna tell me if such and such was doing this, but you ain't tell me that such and such did this to this person in my family? Is crazy. So I do think that, as unfortunate as it is, even within the Black community, these instances of incest, these instances of molestation against not only younger women or women period, but it happened against boys as well. And so there has to be a conversation that's had to normalize it so that it don't continue to be normalized.
Yeah. And I think that's the big thing. I think that right there is the big thing, like creating space so that people can talk about it
Yes.
and not feel the shame around it. Like that's the piece. Majority of this stuff, like y'all know the saying, like we don't talk about nothing that happened in this house. So it's like
It's in this house, stay in this.
exactly. So it's like it can't be that. We need to start addressing the things that are happening, and we need to create environments outside of the therapy room, outside, and therapy is good. Therapists are good. Outside of the mental wellness groups. Mental wellness groups are great. But we in our everyday interactions need to start holding space for people that we care about and people that we love to express those things. And we need to start truly asking people on a deeper level, like, how you feel right now? Are you good? What's going on with you? Like, our conversations need to be meaningful. And this is not a podcast episode about social media, but I believe that the distance that social media has created from you to me has made it even more difficult to have those deeper conversations. Because right now, we could be talking about your trauma, and the next second, I could care less about it because it's on to the next thing.
Right.
You know what I'm saying? So I truly believe that people have to start being more intentional, especially if you're a parent. You need to be more intentional with your kids about hearing your kids and not just having your kids hear as, this is my helper. This is my cute daughter or cute son on picture day. I got him in the J's and the matching outfit. It's not about that. It's about what are you truly experiencing? Like, what's going on? How do you feel? Like, how have the ways that I've treated you impacted you?
Absolutely.
What emotions are you actually feeling? Because when we start to talk about those different things, now we truly are able to like process those big T and little T traumas so that they don't grow into these things called PTSD, so they don't grow into reactive attachment disorder, and they become resilient in the end.
Absolutely. Absolutely. I think the conversations at home are imperative in really communicating because you want to hear. You want to hear what that person is saying and then follow through. Don't just listen and just go on. No, hear them and then follow through.
Yeah.
You know, a lot of times people will say, "Well, I told my grandma or I told my mom," but they didn't do nothing about it. And when you go and you talk to the mom or the grandma, they say, "Well, I mean, they mentioned something, but I didn't know what they were saying because they weren't communicating. They weren't listening to hear. They weren't hearing them and taking it in. Therefore, they didn't give them the right response because they didn't hear them in the first place. They was listening but wasn't listening. And so once we actually get to a place where we really are communicating with one another and we're paying attention to everything that that person is saying, then the quality of that supervision gets higher. We're not putting them in places where they've already told you they don't want to be. We're not allowing them around people that they've already said, that person make me feel uneasy, mama.
That part.
When I'm around them, I don't know, my skin kind of crawl.
That
Well,
part.
go on over to Cousin Tina's house anyway. You be all right.
My cousin Tina.
Well, listen.
That part. But I think it gets back to what.
It could,
Yeah.
you know, it could be anybody. You know what I mean? But ain't that how they do? Go on over there.
That
Be all
part.
right.
That part.
Turn a
Mama
blind
gonna go
eye
out
to it.
for a minute. Daddy about to make a quick run. Go across the street and play for a second. You know, I mean, it's something that on a day-to-day basis happens all the time, but people don't really look at it on the bigger scale
That part.
because they're just thinking the person just don't want to go to their grandma's. They're gonna sit over there and be bored. But really, they don't want to go over to grandma's because grandpa touching them.
Yep.
So it's paying attention
Right.
and it's listening to listen
That part.
and then follow through.
That part. I do
them safe.
think what you was mentioning about social media, it created a dynamic where it's not only just rifts between friends and family members, but between parents and children.
Yes.
So you don't even have a baseline observance of behaviors to even know when your child has modified from a normal behavior.
No.
You don't know your kid's favorite color. You don't know none of these things. You put them in front of the screen and tell them to go on their way. So you don't notice that your child, who is usually jovial, when Uncle such and such come into the room or when Aunt such and such come into the room, they didn't go into a shelter of themselves. You don't know who your child is. And some of it is not intentional. So it ain't all on the parents just from being bad parents. If you're dealing with a single parent family home and mom got to be a provider, she isn't afforded the opportunity to get to know her child on an intimate level, to know the baseline behaviors, to even understand or recognize when they deviate. So I do think it's important for parents to take time to know their children,
Right.
so that they establish these baselines, but also pay attention. If your child, you know your child bubbly and you know your child love to give everybody a hug, but when it comes to such and such, they don't want to give them a hug, don't force that child to hug that person. If they
do
like,
it.
they don't want to, hey, listen, I got little nieces and nephews all the time. Sometimes I get a hug, sometimes I get a fist pump. I ain't gonna force you to hug me. You know what I'm saying? So pay attention to your children.
I think everything that we talked about here today is really good. Something that I think possibly on a future episode that when trauma is readdressed, bro, I think just knowing your story and knowing your experience and being able to talk about how trauma has impacted you from the perspective of being a victim, but not in the position of what most people would think is a victim. I think that could speak a lot, or speak to a lot of people, and really start to like unpack some of the complexities of how trauma and being a victim in different situations can impact us. I know we probably got like a minute left. If you could real quick just touch on like, touch on like what it meant for you, or like what victimization looked like for you, and then in a future episode really dive into that.
Yeah, I think for me, one of the main things was understanding that there's a whole different dynamic to being a victim of violence. What about the people who are inflictors of violence? And it make me think about, I would always hear how the slave and the master are both intertwined, as in like the person who is the master has a dependency on the person who is enslaved, and the person who is enslaved has a dependency on the master. And so when I think about those dynamics, for me, it was knowing what I was capable of doing. So we always talk about what we would do in the case of violence or how we will respond to certain different situations. But when I was put into a position where I had the opportunity to take somebody's life, and then another person I actually ended up having to shoot, it messed me up, because my baseline before then, I thought I was a thug. You know what I'm saying? I thought I was just, I even ran around as a little killer. But when I was put into a situation where somebody was begging me not to take their life, and I actually took somebody and had them had a 10% chance of living, it made me re-examine the dynamic of what it means to be an inflictor of violence. So a lot of times when we talk about victims of traumatic experiences, we only think about the people who the traumatic experience happened to. But what about the person who actually had to do the traumatic experience? How do you then humanize yourself? Right? Do you then dehumanize the other person to make an excuse for what you've done to this person by taking away their humanity? And so when I think about that, that kind of made me think of the brothers who going around out here who can't sleep at night, especially because of the things that they've done. Is not even something that somebody else has done to them. You shot up this house and an innocent person got hit, and this wasn't even your intended target. How do you sleep at night? Do you sleep at night? I know people who have been in similar situations, and they tell me that people hunt them. So I think their trauma is a very widespread conversation. But when we talk about victims of violence, victims of unfortunate circumstance, think of the inflictors of those circumstances too, because they deal with as much trauma as the person who the trauma was inflicted on.
Y'all gonna have to tune in for another episode to hear the full thing, because that's deep right there.
That's deep.
Yeah.
That's deep.
Yeah.
Go ahead, carry us out.
Oh man, well, we was talking about trauma. We talked about a little bit of everything.
We did.
So I think we hit on reactive attachment styles. We talked about attachment styles and how trauma kind of can lead to down the road being diagnosed to more serious trauma styles like PTSD. We talked about how PTSD is not the only type of mental affliction that happens from trauma. Prolonged trauma. We talked about big T trauma. We talked about little T trauma, and how trauma ultimately is any type of wound that a person has to recover from. And so I did think that we probably should have went into some more strategies, but that's probably for another episode. We can get there on another episode. Or what are some of the strategies to dealing with trauma? What then do these type of triggers, right? Because it'll trigger a post-traumatic episode. What are the cues then that people could recognize to be better to deal with it, especially if we're talking about somebody who has been put into an abusive situation? We talked about how it's not necessary in the last episode. We talked about how it's not necessary to have a person re-exposed into an environment. But what was the name of the practice that you said?
EMDR.
EMDR.
Modality of treatment for people.
Yeah. So there's ways in which a person can then explore that trauma without having to be re-put back into that situation. And personally, from my experience, I think that that's helpful for a lot of older adults who may not have the tools or have been afforded the space to be able to even talk about the traumatic things that have happened to them. So I think with that being said, we had a very dynamic discussion, but we're going to go ahead and close it out. So I'm your host, Johnny No Good.
I'm Monica Lewis.
I'm Peyton Hogan.
And we out.
Peace.